holiday season has been upon us, and many Americans have gathered for lots of parties, large meals, and family gatherings over the last few weeks, which have involved consuming excessive food and alcohol. Holiday heart syndrome is a real and serious medical condition that occurs when we consume large amounts of food, alcohol, caffeine, and salt. One symptom of the condition is heart rhythm disturbances, including atrial fibrillation, the most common heart rhythm disorder. In atrial fibrillation, the heart beats rapidly and in an irregular fashion. Atrial fib can result in health complications, including stroke. Holiday heart syndrome can also lead to a weakened heart, a condition called cardiomyopathy, congestive heart failure, and even heart attack. The condition is often associated with the stress of holiday time, and caffeine and dehydration can also play a role. Here's how these common holiday habits can impact your heart. Overeating. Basically, when you eat a large amount of food in one sitting, it causes the stomach to expand to accommodate large indulgent meals. This distension of the stomach can result in a stretching reflex that stimulates the nervous system and initiates fast heart rhythms such as atrial fib. Consuming too much salt. Look, we need salt, but when we consume too much, our bodies can hold on to fluid and cause our blood pressure to rise. People with CHF should really avoid consuming excess salt, as this can increase the chance of heart failure and cause shortness of breath and swelling. So if you have congestive heart failure, please watch out for that salt. Binge drinking. Look, while some research shows that consuming alcohol, particularly red wine, is good for your heart, most studies suggest that alcohol, to be heart healthy, the consumption must be in moderation. When we drink in excess, alcohol can become cardiotoxic and weaken our hearts and cardiovascular systems, which can cause an acute effect on the heart rhythm, resulting in, again, atrial fib. The symptoms of holiday heart syndrome include a rapid pulse rate, shortness of breath, chest pain, and swelling in the ankles or feet. In some cases, the condition can actually cause the heartbeat to become so fast that the person may pass out, and in severe cases, heart attacks can occur. And not coincidentally, heart attacks are common during the holidays. They're most common on December 25th, followed by December 26th and January 1st. If you have any holiday heart syndrome symptoms during these holidays or otherwise, please call 911 or go to the hospital immediately. Your life depends on it.